why don't you tell everybody what an integrative pediatrician is? Because I think many people are familiar with pediatricians, but what separates a pediatrician from an integrative pediatrician?
So for me, I really define it as trying to balance the best of modern medicine with alternative practices. So I'm not against Western medicine at all. I always start off by saying that because I think it's really important to mention that, if you get an antibiotic, it can save your life. We have amazing emergency departments where we can go and get an MRI and X-ray. I think all these things are great, and there are all sorts of things that we've invented that can be very useful. But there also are a lot of other modalities that have existed for a very long time that can be useful in many situations. And so I just try to blend the best of both worlds together and use natural remedies whenever it's reasonable, and not an emergency type situation. And I just think there's a lot of opportunity for that. And there's actually a lot of research on many of supplements and herbs that can be very helpful. And medicine in general doesn't have a lot to offer and doesn't focus on prevention for a lot of these chronic diseases or long-term things.
What you're saying really resonates with me. I'm not an integrative pediatrician, I'm a general pediatrician. However, I think it's very well established that there's a lot of overuse when it comes to medicine. And
Mm-hmm.
so, how nice for patients that want something to try to help their kids, if they can't take home an antibiotic or it's really not in their best interest, to have an alternative option to try to feel better.
Right, exactly. And I mean, the very classic example is something like ear infections, right? I mean, you can look at ear pain and the guidelines from the American Academy of Pediatrics, and even in the guidelines, unless it's very severe pain or both sides or a few other things, then you're not even supposed to really treat them in the first day or two. You're supposed to do some watchful waiting, and you can offer them a script to take home, but maybe not to do it. But the problem is that parents want to do something. Their kid's in pain, they have something going on, and I feel like most parents would be much more comfortable giving it that day or two if they had some other natural remedies to try. And it seems to be that way. I mean, in my practice, when I used to work at the hospital, and before I even really started doing a lot of integrated medicine, it's like somebody comes in with ear pain. Here's your script. Good luck. You go to the urgent care. No matter what the severity is, it's like, oh, they have a little bit of ear pain. They had, this, and that. Maybe it's getting a little better. Okay, here's your prescription. Good luck. Like, there's no other alternatives. But the reality is, if you give people something to do, then the vast, vast majority, more than 90%, probably like 98%, 99% don't ever need the medication because it just gets better. Because just look at the stats. It's mostly viruses that are going to be causing that ear pain. So the antibiotic's actually doing nothing. If anything, it's causing harm.
It's so true. And I feel like the system is set up for doctors to want to prescribe because, first of all, parents, when they have their child that's in pain, I'm so sympathetic, I'm empathetic. They want to do something to help their kid immediately. And for doctors, quite frankly, it's so much easier to write a prescription and send them home with that prescription. It takes time to explain why the prescription isn't in their benefit, why they might want to watch and wait, treat the pain in other ways. And so I think you're absolutely correct that if you can give parents a proper explanation as to why it's in their best interest to wait, I think most parents are on board.
Mhm. Right. I mean, the parents want the same thing that you want. You want their kids to be healthy. You want them to recover. That's what they want. They don't want to give an antibiotic that could cause, some gut issues, some diarrhea, whatever it is, if they don't have to. But they also don't want their kids' eardrum to burst or, them to have hearing problems or other things. So they just want to know that it's okay. But that involves a lot of discussion, a lot more than just giving a prescription. And the system is really not set up great for most practitioners. And on top of that, the other huge key is you have to be able to have follow up. Like, and that's not necessarily the case in a lot of big box office practices where if you give somebody something natural, let's say for ear pain, and then they go home, they have to be able to get a hold of you. They have to be able to understand what to do because it could get worse. It could get much worse, and maybe they do need antibiotics. So they have to be able to follow back up. And in private practices, it's more. I guess it's easier for a lot of patients to kind of follow up and have a little bit better access, whereas some of the bigger practices they don't. And our kids would do better if we could change the system up somewhat to help this. I mean, we have antibiotic overuse. We know that's a huge problem in medicine and antibiotic resistance. And there are a lot of remedies that can be very helpful, like elderberry syrup. There's tons of evidence on elderberry syrup being helpful. There's tons of evidence on vitamin C. There's tons of evidence on zinc. All these things are known to be helpful to some degree, to be supportive of viruses, and yet it's like not common knowledge, not commonly used for whatever
Well,
reason.
well, the other perspective that I have on that is, let's say they're not that helpful. What is the harm? I mean, besides, I
Mhm.
guess you have the cost, the out of pocket cost of the supplements. But certainly, if they're providing some immune support and maybe they're not changing the course of the illness that much, let's say, there is a benefit to placebo. There's a benefit for parents to feel like they're trying to do something that potentially may help. So I have no problem with supplements like elderberry, vitamin C, zinc.
Mhm.
I agree with you.
Right. It's very important not to do something that's dangerous. So there's that side too. But there are things that are dangerous. So that's where you want to go with items that are very safe in general. And almost every supplement that's out there is much safer than medication. I mean, anything can have side effects, but the reality of vitamin D or vitamin C or those kinds of things having a reaction or an overuse or toxicity is very, very low. Anything's possibly can be allergic to anything, but I
Yes.
mean, the reality is that either it helps a little bit, it's not magic, right? It's not a medication, so you have to understand that. It's not like you're going to get better within 15 seconds of taking vitamin D, but it's supporting your immune system. And even, again, like you said, if it doesn't do anything, it's still placebo effect, and that's a huge effect for most people.
Absolutely. What I find is very underappreciated or underacknowledged is how time is really our best friend. It's that
Mhm.
often these illnesses don't get better right away. It is normal for fevers not to get better after a day or two, and it's okay not to act and treat with an antibiotic or a strong medication. It is
Mhm.
okay to do your best to make your child feel comfortable, support them, but that, as you mentioned, is the value of follow up and having a close relationship with your pediatrician. That if you are concerned after a couple of days, you can reach out to your doctor and go through the questions and make sure that it's still safe to monitor and give the child time to recover from their illness.
Definitely, and that's one of the big reasons why I wrote the book "Parenting at Child's Pace," and it's a big, mixture of the common parenting questions that you get, plus a little bit of the health side and the wellness side. But a big part of what's happening with parenting these days is we're very stressed. Parents are very stressed, and they're not really sure what to do or what to worry about. And I find that people worry about the very wrong things, and they're not worried about sometimes the things that they should be worried about. And you mentioned something like fever. We talk about that a whole bunch in the book because people are so worried about fever and as patients it's like you remind them you're not worried about the fever in general, it's the other things. Like, you're supposed to have a fever when you get sick. That's pretty normal. It might be a day, it might be 2 or 3 days, but that's still pretty common. So it's what other things are you looking for? But we're so ingrained with this fever phobia, and I think it's important to know when to be worried, because yeah, you should be worried sometimes but not most of the time.
I don't know if we as a society made it worse when we did all the fever checks.
I think
Remember
so.
those days of,
I think it's that, and I think it's also that we are very concerned about fevers in newborns, and so you talk to parents pretty early. Parents hear about it pretty early. It's like, oh, go to the hospital, lumbar puncture, yada yada, this and that, and we put a lot of fever phobia, I think, into our own patients, and so it's
yes.
something that we have done as a medical establishment because with a newborn, it is actually a big deal, but it's not as much of a big deal in general for an older kid. So I think it's that initial fear for a parent, and then maybe they don't really get the message that it's different when
And it
they're
just
four.
carries over.
Yeah.
That's an excellent point.